Thank you very much for inviting me to speak about the role of natural history studies in advancing research for CDGs and NGLY1 CDG. In my talk today, I will start by answering the question of what natural history studies are, then dive into why they're important, and talk about what makes a natural history study successful. Then I will go into specific natural history studies that are currently active for CDGs and NGLY1 deficiency, and give examples of relevance to development of therapies in CDGs within these examples, and end by addressing some frequently asked questions. So what is a natural history study? It is a study done to understand how a medical condition or disease develops and evolves over the course of that disease in terms of their symptoms, the severity of symptoms, etc. Usually it follows a group of people who have a specific condition, collecting health information from these individuals. And ideally, it would collect this information from the disease's onset until either its resolution or the individual's death. So in the case of CDG, we would be collecting entire life's worth of information from the time of birth to death. To clarify, it is not studying the effect of a treatment on the disease. So to give an example of a natural history study, I'm going to dive into the past and look at this natural history of the common cold. It was derived in a study performed at the research unit at Harvard Hospital in Salisbury, Wilts. Caveat, this study probably wouldn't be able to be done currently, or it'd be difficult to do this, because what they did was actually invite volunteers, mostly college students initially, to enroll in this natural history study. They came in and were admitted to a flat where they were isolated until their disease resolved. And they actually were given the virus, a virus that was known to cause the common cold, and swabbed with this virus into their nasal cavity, and then observed with many observations about any symptoms they experienced, had their temperatures taken, etc. And from this study, we found out that on day 0, when individuals were exposed to the virus, there were no symptoms. But after 2 days, the majority, not all, but at least more than half, developed some symptoms, which consisted of fatigue, sneezing, and headaches mostly. Following this, shortly, on day 3, runny nose and cough evolved. Sometimes there was a low-grade fever, but not very frequently. And then these symptoms would kind of persist until about day 7 to 10, when most people, about 50 to 55%, recovered completely. But 30 to 40% had a lingering cough that took 18 to 25 days to recover from. And 10% of individuals even had a lingering cough that lasted longer than 25 days. So from natural history study of the common cold, we found out this information. So why is understanding natural history of a disease important? Well, going back to our example of the common cold, it is nice to know what typical symptoms to expect if you have the common cold are, and how long symptoms would tend to last, if they got better or worse, and which ones lingered longest, so that when you got the disease or have a disease, you can almost predict the future to a certain degree, at least, if you knew the natural history. And that's helpful in planning your life and maybe watching out for certain things, knowing to take it slower, probably for about 7 to 10 days. But in addition to knowledge and being able to use that knowledge to plan your life, it's also very important in discovery and testing and understanding of new treatments. So, as an example, if you had a new therapy that was being developed and tested, and it was given here for a cold on, say, day 5 of illness, and after 2 days, symptoms are gone in 50% of people, if you didn't know the natural history of cold, if you just thought maybe cold lasted forever, you would think that this new therapy was actually great. But knowing the natural history that 50 to 55% would recover completely without any treatment just by the natural course of disease, we know that this new therapy A is really not worth very much, more of a hassle than a treatment. However, if there's another therapy, a new therapy B that was being tested, and it was given on the first day of symptoms, and after 2 days, all symptoms are gone in 90% of people who took it, this is a different story, because as we know in the natural history, usually people still have symptoms up to day 7 to 10. So maybe new therapy B would be an effective treatment to help treat the common cold. Of course, you'd have to weigh how much new therapy B costs, how difficult it was to take, but knowing the natural history allows you to better evaluate new therapies for the disease. What makes natural history studies successful? There are 3 main things that really can help a natural history study be successful and collect data that is useful in the future development of therapies, for example. And that is being able to collect data that's useful and consistent. So data that is relevant to the symptoms of the disease, and that this data is collected pretty normally or routinely or regularly wherever it's collected. So being able to know how to measure weight properly and having each piece of data of weight being measured properly and entered in is important. Also, including as many individuals with the condition as possible really helps make the natural history study successful, because that allows us to really understand the spectrum of disease and help us get a very accurate information about how a disease can evolve. And being able to follow individuals over a longer period really helps natural history studies get more information that can be helpful in the future. And what is in common with these 3 things that help natural history studies become a success? They need patient and family participation and engagement. So you are an integral and absolutely necessary part for natural history studies to be successful. So diving directly into specific natural history studies that are currently active, this is the list that I could find, at least. I have to give a caveat that maybe I'm missing something, but these are the ones that I am aware of. So the first and the oldest study that started in 2009 is one for congenital muscle disease. While there are many congenital muscle diseases that are not congenital disorders of glycosylation or CDGs, there are a group of CDGs, the alpha dystroglycanopathies, that are considered a congenital muscle disease. And these conditions, these CDGs, are studied under this particular study, which is the Congenital Muscle Disease Study of Patient and Family Reported Medical Information. And as the title suggests, it really focuses on looking at family and patient reported medical information. The second natural history study that is very much integral to CDG and NGLY1 is the natural history study that was performed at the intramural site of the NIH and NHGRI. And in this natural history study, it focuses on only CDGs, but it is able to study all CDGs as well as NGLY1 deficiency. This study started in 2014 and is still recruiting individuals and active presently. Third natural history study is the Glycomine study. So Glycomine is a company that is working on a specific therapeutic for a specific condition, PMM2-CDG. So the natural history study that this company is sponsoring is for PMM2-CDG, and it has been ongoing since 2017 and is active presently, although not recruiting new individuals. And the last natural history study is the Frontiers of Congenital Disorders of Glycosylation, funded by the NIH, is a natural history study. And it also studies all CDGs and NGLY1 deficiency, similar to the original NIH natural history study. And it's been ongoing since 2019, and we are definitely still recruiting individuals. I'd like to now give more details about some of these natural history studies, as well as some past natural history studies, and give examples of exactly how they are currently contributing to the development of new therapies and treatments for these particular conditions. So the first example is the Frontiers in CDG natural history study that was the last one on the last slide. In this natural history study, it is a multi-site natural history study that includes all of these sites you can see in the US and in Europe. There are over 10 sites throughout this region. The specific aims, which is a scientific term for goal or goals of the study, is to figure out what health problems and laboratory abnormalities and symptoms individuals with CDG and NGLY1 deficiency experience over time at different ages, and to validate the CDG rating scale and patient quality of life and reported outcome measures for CDG and NGLY1 CDDG. And this is important because many times outcome measures in clinical trials may be partially a patient-reported outcome, because that's what's most important, how the patients feel that they're doing. If we're able to achieve that, the reason to achieve those goals is to really better understand the disease so that potential therapies and needs can be identified, and to provide the groundwork needed for future clinical trials to be successful. In terms of what we're actually doing, or the scientific term methods, we're really just collecting health information at baseline and once a year. And we do this at visits to each of the clinical sites, now sometimes virtually. And what we collect and put into a database in a secure way are information from routine clinical care visits. So information from the interview that your physician or doctor takes, the history that they perform, laboratory tests that are collected to test for things that are needed for clinical care, to care for the individual with CDG, and studies such as echoes, MRIs, EEGs that are done in the course of treatment and monitoring for the disease, as well as a food diary. In addition, two pieces are also collected. One is the goal attainment scaling score, which asks individuals with the condition and their families what 3 long-term goals they'd like to focus on, and then annually ask them if they're making progress towards these goals or moving away. And then also the quality of life questionnaires that we touched on before. And an example of a quality of life questionnaire is the Parent Proxy Global Health 7+2. And just really, they ask general questions about how the parent or proxy views the child or affected individual's health. For example, an example question would be, in general, how would you rate your child's physical health? And you're able to rate it on a Likert scale of 5 to 1, where 5 is excellent and 1 is poor. Although this is very subjective, we would track this over the course of time, and then it could be compared in individuals who are in a clinical trial to see if that improvement is better. And of course, the most important outcome is really the quality of life of individuals with the condition. So even though these are subjective measures, they are important. So from this natural history, we've collected a lot of information, but one result that we found is this information on this liver injury marker, ALT, in individuals with CDG and PMM2 and non-PMM2. So ALT, like I said, is a marker of liver injury, and higher numbers is worse liver injury, and numbers that are below this blue line are normal. So having collected this information through the natural history study, we found that in PMM2 individuals, when they're very young, age 0 through 5, their numbers of ALT, the marker of liver injury, is very high and very abnormal. But without any specific treatment, it seems to normalize by itself by the age of 6 to 7, although there are some blips that occur later at random times. This is very helpful information because, for example, if there was a therapy that was developed and given at age 5 to people, and they found that there was a correlation with an impressive improvement in ALT, we would know that that's actually not something that we would want to be so excited about as a therapy, because it would have improved by itself naturally. Similarly, we did gather this information in other CDGs, but unfortunately, we do not have enough data. It's very little data that we have to be able to have as strong of a case and understanding of the condition. There is still the common trend, but we do need more data. And so more individuals with more data makes the study much more powerful. Moving on to the second example, I'm going to actually discuss a little bit about an NGLY1 natural history study that is not currently active, but was active recently, as well as the NIH intramural study that is currently active in the context of NGLY1 deficiency, and a result that has arisen from these two natural history studies combined. So this natural history, the prospective natural history of NGLY1 deficiency, was ran out of Stanford in California. This study is a single site study, and it comprises of either on-site or remote enrollment, which is a very novel method of doing natural history. It comprises of annual visits and 4-month video visits, or annual video visits and 4-month interval video visits. And the video visits really allow individuals, even from very far away, such as South America, that cannot travel, to be able to contribute their data. In terms of the evaluations that are performed, again, a lot are similar to evaluations that are done clinically, such as the clinical and developmental history, neurologic and dysmorphology examinations, a movement disorder assessment with video, seizure history, eye exam, EEG, nerve conduction study, autonomic testing, neuropsychology assessments such as the Vineland and Sanford social dimension scale, quality of life questionnaires, as well as laboratory results. For those that can only enroll remotely, this list of studies are the same, but more limited. So labs, for example, cannot be collected, but still valuable information. In terms of the NIH natural history study that is ongoing, it is also a single site natural history study run from Bethesda, Maryland. And this natural history study has an impressive schedule. Usually individuals go to the NIH in Bethesda and have an entire week of many, many assessments. In this natural history study, a strength is that these assessments are taking place in one place. And for example, all the labs are run in one lab. So the data is quite uniform in terms of the pieces that are collected for that natural history study. As part of the NIH natural history study, one of these, as well as the Stanford natural history study for NGLY1, tear production is measured by a test called the Schirmer test. And this is for the NIH natural history study just performed in NGLY1 deficiency and other CDGs that have low tear production as a known symptom. And this Schirmer test, although it looks a bit awkward, is actually pretty simple. And we were able, and what you do is basically put in filter paper under the eyelid and see how many millimeters of tears run down this filter paper in 5 minutes. In normal individuals, the average number of millimeters that the tears run down is about 16. And when combining the data from the Stanford Natural History Study and the Natural History Study from NIH, we find that in NGLY1 individuals, the natural history number of millimeters of tears that is able to be made is 5 millimeters, which is substantially decreased. Knowing this result, we are designing a clinical trial to see if a particular therapeutic agent is able to increase tear production. And so because we know where the baseline tear production is for NGLY1 individuals, we're able to calculate how many people need to be in the study to make it likely to be successful. And we also know from the experience from natural history study that we can do this assessment as a pretty accurate way to measure tear production in this population. And moving on to the third example, ataxia and PMM2-CDG. The natural history study also is not currently enrolling, but it was run out of Spain by Dr. Serrano et al. And it really focused on looking at the ataxia or balance issues in children with PMM2-CDG. In their study, they measured a score called the ICAR score, and it's a score for ataxia or balance. The higher the score, the worse the balance issues are. So what they did was they measured initial ICAR score, and then they measured a second ICAR score at least 18 months after the initial ICAR score. And what they found was the initial ICAR score was definitely not normal. Normal is 0. It was more around almost 40, but not quite on average. But then what they also found was that on the second measurement, it was lower, substantially lower. And when you took all the data points together and averaged them, it seemed like the ICAR score decreased by about 3 points every year. This information has really helped us designing the randomized controlled trial for acetazolamide for ataxia in PMM2-CDG. It allowed us to know what kind of endpoint we could use that could measure ataxia, and that's the ICAR score, really a mini ICAR score. And it allowed us to know what kind of effect we would need to see for it to be at least statistically significant, so that we could again calculate how many patients we need to enroll to make the study more likely, if the effect is there, to be successful. So now I'd like to end with just a couple of frequently asked questions. One is, how do I find out about natural history studies? Well, one way you are already currently doing by either watching this video or by attending this meeting. But even at home, not watching a video, there is another way, and that's by going to this website called www.clinicaltrials.gov. When you go to this website, the landing page looks like this. And what's important is you can put in search terms under the condition or disease. And for our group, likely relevant search terms include CDG, NGLY1, ALG6, PIG-A, or congenital disorders of glycosylation, PMM2. So the disease or the gene name are very good search terms. And when you put that in, so I put in CDG here, and you hit search, you get a list here. So I put in CDG and hit search, get a list of studies that are related to this particular condition. When you're looking for natural history studies, as we discussed at the beginning, it is not of an intervention or therapy. So in the intervention column, it would be blank. So when you search for CDG on the first page of results, you see there are 2 non-intervention trials. And the first is the Natural History Protocol on PMM2-CDG, sponsored by Glycomine. And as you can see, it's active, but not recruiting. And the second one on this first page is the natural history study from the Frontiers of Congenital Disorders of Glycosylation Consortium. So since that's active, I decided to click on that one. And when you do this, you get to another page that gives you more information about that particular study that you clicked on, including when it started, how many participants, and if it's observational. And then scrolling further down on the page, it talks about some important information, such as inclusion criteria and exclusion criteria. These are things to pay attention to because this can tell you whether or not the individual, you or your family member, can actually participate in the study, because they have to meet all the inclusion criteria and not have all the exclusion criteria. This study is pretty simple. They just need to have a diagnosis of a CDG based on genetic testing. And the exclusion is you don't have a CDG. If you don't have it, you can't be part of the study. Scrolling even further down, another piece of very important information is the contact and location. So you can figure out where it's being done, and the emails of the people who are doing the study and know the most about that particular study, as well as some of their phone numbers, are listed right there. And that is the most accurate. By reaching out to them, sending an email or a phone or making a phone call is the best way to get the most accurate information about a particular study that you are interested in. And my second question, can you participate in all studies, as there are multiple, you can see, or do you need to pick and choose? So assuming you meet all the inclusion criteria and don't have any of the exclusion criteria, at this point, participating in one natural history study usually does not preclude participating in other studies. And I would say that's in general true. So it's, i.e., a la carte. And we do try to attempt to minimize extra effort for families. So many studies allow, for example, labs that are collected in one study to be used as data in another study, as long as the family consents to this. So that's all I have. I hope that you've learned a little bit about natural history studies, and thank you very much for your attention.